Tēnā koutou e ngā matapa waka, tēnā koutou e te hau kaianga te ati awa, tēnā koutou. Ko Ayesha Verrall ahau, minite o te corona, tēnā koutou I runga I te kaupapa o te ata, nō reira tēnā koutou, tēnā tātou katoa. I'd like to start by acknowledging the other presenters from Aotearoa, New Zealand, and to extend a warm welcome to those joining from other countries. There's a wealth of knowledge and experience represented here today, and I trust everyone will take considerable value from the discussions you're about to have. Kia ora to the people I've worked with on the past attending today, and also many who in fact taught me when I was at medical school, and that includes you, Professor Mann. It's lovely to be here with you today. I wanted to recognise the excellent mahi you all continue to deliver and your contribution to wider research, science and innovation in our system here in New Zealand. I want to take this opportunity to talk about the critical importance of strong linkages between research policy and practice, and Te Ara Pairangi, the Future Pathways Programme. Unlocking the power of science and deploying it to improve health and well-being is so important to me personally. In fact, it's why I've come to Parliament. That's why in my first year as Government Minister, I've championed evidence-based policies through initiatives such as mandatory fortification of most bread-making flour with folic acid to prevent neural tube defects, and ensuring a nationally consistent approach to fluoridation of community drinking water to protect New Zealanders from the pain and costs of tooth decay. I've also sought to improve our use of experts and bring science into the COVID-19 response, commissioning advice from groups such as those led by Professor Sir David Skegg to help inform government decisions as the pandemic evolves. But picking up on the remarks of Professor Mann about the frustrations that surround the uptake of evidence into health policy, I acknowledge that we want to make this much more routine and systematic throughout our health system. And recently, to that end, we reached a significant milestone, the introduction of the Pai Ora Healthy Futures Bill to Parliament. This bill will enable us to reform the health and disability system. And we have strong aspirations for improving our uptake of science through this bill. We want to bring a well-being approach to our health system. We want to have a public health agency at the centre of the Ministry of Health with a strong technical capacity to work with you and the research community to collaboratively address our health challenges. We want to bring a health and all policies approach to work across government to ensure health is prioritised in everything we do, tying in with the importance we place on well-being. And so often, science tells us we should focus on prevention and early intervention. I'm sure that is another frustration for clinicians working in our health system, seeing the large burden that preventable illness places on us. One tool we will use to reorientate our system and achieve that is the development of health plans between the new National Health Service called Health New Zealand and the independent Māori Health Authority. Those plans are crucial to getting that reorientation towards population health and preventive care. However, as we have seen through our COVID-19 response, whether that's in the vaccine rollout or public health interventions such as contact tracing, our ability to achieve impact with evidence-based measures is also limited by our ability to reach communities. We need to address this, and we are addressing it through the COVID-19 response, but also through other work that we're doing. For example, a program that I work very closely on is the Smoke-Free 2025 goal. And part of our work on that will be ensuring that we mobilise communities to help their members quit smoking, as well as taking evidence-based action to change our tobacco regulations. And the wider health reforms provide a new and exciting opportunity with their focus on a locality-based approach to population health. At the locality level, we will see different strands of healthcare integrated, so New Zealanders can access support and treatment tailored to their needs, regardless of where they live. For instance, this would mean a whānau bringing a new pepe into the world could access support from a trusted healthcare worker who can then bring in assistance where needed from a wider team that they are connected with of general practitioners, practice nurses, midwives, the Well Child Tamariki Order System, and Kaya Whina. They would also have good links to social support from services such as Family Start, an intensive home visiting program that works with vulnerable children up to age 5 and their whānau. These types of models are already being tested through the Start Well prototype in South Auckland and enhanced support pilots in Lakes, Counties Manukau, and Tairāwhiti DHBs. This type of integrated care is key to improving New Zealanders' wellbeing, and we want to see it established around the country. Improving the use of science in the health system is a priority for me and the wider government, and we're addressing this through several initiatives. It includes investing in up to 385 million over 4 years in systems that support data through a program known as HERA. Formerly known as the National Health Information Platform, HERA is key to making healthcare more accessible, sustainable, and resilient, improving health and wellbeing outcomes and taking steps to resolving inequality. It will deliver data services that enable health information to be published, discovered, and shared across the health and disability system in a secure way, and applications and websites which allow individuals to securely access their health information across the system, and health providers to access that information about the people they're treating and caring for. HERA will also empower people to monitor their own health. They'll be able to update, contribute, and correct their own health information and authorize for it to be shared with their support network. We need people with appropriate understanding of health working in teams with cutting-edge data science skills in order to be able to unlock the power of data in the health system for healthcare and for research. In addition, last month I announced a 1.8 million investment in the Medtech research translator. This program will translate the findings from publicly funded research into solutions for unmet clinical needs, delivering new medical tools. Each project will have a researcher, clinician, and commercialization expert on the team. We want to ensure this project lives up to its name, Te Toki Mataroa, with strong Māori and Pacifica partnerships underpinning new research, focusing on co-created technologies that rebalance health, that address health inequalities. Diversity provides wider perspectives that reflect the needs of our diverse societies, and so building that in to this program from the very beginning has been key. Now to turn to Te Ara Pairangi, or the Future Pathways program. Some of you will have attended the recent launch that Minister Woods and I did online as well, or read the green paper that we have released. Our research, science and innovation system has served Aotearoa New Zealand exceptionally well, and the research community's work has provided significant environmental, economic and social benefits. But the system has been through multiple changes over the last 3 decades, and it's now time to consider how best to position it to meet the coming challenges and opportunities. There have been a number of reviews of the system, such as last year's Te Pai Kahurangi review into the Crown Research Institutes. These reviews identified areas where the system is not performing as well as it could be. Our system is made up of great people, but we need to make sure they are properly supported to carry out impactful research. And we must find ways to change the precarious nature of many jobs in the sector, particularly for early career researchers. This is something I feel really strongly about, having worked in health research. The sector must also adapt to better represent New Zealand. We know only 5% of researchers identify as Māori, 1.7% as Pacifica, and around 1/4 of professors and deans are women. I'm confident the sector will have innovative ideas on how to better attract and develop talent, widen participation, and address retention issues. We want to develop these ideas through the Future Pathways process. We also need to match the benefits from our research and science with a modern, future-focused research system that is connected, adaptable, resilient, that embeds Te Tiriti across the design and delivery attributes of the system and supports opportunities for Mātauranga Māori. It's important that the system builds on the great work already underway to address Aotearoa New Zealand's key challenges, such as climate change and the COVID-19 pandemic. We will ensure we protect the best parts of the system while addressing those parts that could work better. Te Ara Pairangi Future Pathways is a multi-year program focused on the future of New Zealand's research system. It seeks an open and wide-ranging conversation with the sector on a range of issues facing the system, about how these issues could be addressed and how to take advantage of emerging opportunities. We will gather a broad base of views, drawing on the collective wisdom of and experience of researchers and research users. The release of the Green Paper is the first step in a conversation about the future of the system, and I encourage you all to go to the MB website for more information about how to feed your ideas into the process. As ideas are developed and refined, there'll be further opportunities over the next year for people to engage in the program. It may take some years for the full redesign to be determined and implemented. Minister Woods often says she wants this to be a deliberative and an open process, so please do participate. We want to see greater benefits from the science done in Aotearoa, New Zealand. The Green Paper contains ideas around better impact delivery, knowledge exchange, and research impact, as Professor Mann noticed. Two of the key questions posed are, how do we better support knowledge exchange and impact generation? And what should the role of research institutions be in transferring knowledge into operational environments and technologies? I encourage you all to engage with Te Ara Pairangi Future Pathways to ensure your individual experiences and knowledge play a part in developing the future science and innovation system. So to conclude, today's event is an excellent example of the research community coming together to share their knowledge. These are some of the unintended positive features we've seen emerge from the National Science Challenges. Te Ara Pairangi Future Pathways can ensure this work will benefit the wider system for years to come. Mā te kimi ka kite, mā te kite ka mōhio, mā te mōhio ka marama. Seek and discover and know and become enlightened. Ngā mihi nui kia koutou katoa.